Hi everyone. Today we're talking about how to set goals in your dental office. We'll keep it simple with 3 steps. 1, review your current data. 2, determine where you want to be. And 3, make a plan, break it down, and of course, celebrate. I'll walk you through each one and then we'll recap at the end. Number 1, review your data. Before you set any goals, you need to know where you are right now. Look at your numbers: production, collections, overhead, new patient counts, case acceptance, whatever's most important for your practice. Then, compare them to industry benchmarks. For example, healthy overhead should be under 50% of collections. If you're overpaying in a category like supplies or lab fees, or if production isn't supporting your overhead, that's the area to focus on first. Pro tip: don't skip this step. Doing a deep dive into your current state of affairs will guide where you should start and where your time and effort will have the most impact. Number 2, decide where you want to be. Once you know your baseline, get clear on your destination. Don't just say, "We want to grow," or "We want to produce more." Everyone wants those things. Be specific. For example, if your overhead is at 55%, maybe your goal is to bring it down to 50%. If hygiene is underproducing, set a daily hygiene goal that ties directly into your bigger office goals. To get even more granular, maybe you notice that the hygiene department's fluoride percentage is lower than your target goal. The specificity will help you come up with a plan that's small enough to be tangible and trackable. Here's a tip: reverse engineer your goals. Explore what's healthy in each category and then figure out what production or percentage would be needed to get there. But please, always remember your why, or be sure to discover your why. Let's say in the case of fluoride, you're not chasing a percentage. You're educating patients and promoting health in the community. You're the gateway to healthy overall life for each of your patients. You want physical longevity and vibrancy for your patients and their families. That's more than numbers. That's impact on real lives. Point 3, plan, break it down, and celebrate. Now it's time to map it out. Take your big goals and break them down into daily, monthly, and annual targets by department and by role. For example, instead of saying, "We want 2 million this year," ask, "What's our monthly target? What's each provider's daily target? How does the front desk support this through scheduling and case acceptance?" And just as important, celebrate the wins. Whether it's a bonus, a team lunch, or a shout out, recognition keeps momentum alive. Another tip: always connect the goal back to its purpose. Goals for the sake of goals don't inspire anyone. Quite frankly, at worst, they can breed resentment and burnout. Make it clear why hitting the goals matter. Numbers are just tools to track the level of care you are providing for your community and for your patients. So let's do a quick recap of what we've discussed on how to set goals in a dental office. 1, review your current data. 2, decide where you want to be. And 3, make a plan, break it down, and celebrate. Okay, I have a challenge for you. This week, pull your most recent numbers and look at the trailing 3 months. Pick one category: supply or lab fee, overhead, collections, hygiene, whatever you'd like to look at, and set a clear, measurable 30-day goal. Share it with your team, explain why it matters, and decide how you'll celebrate if you hit it. Don't worry if you don't execute perfectly or explain what you're trying to do as well as you'd like. The goal is to get started and have some repetition with setting goals and working toward them. And ask your team for their feedback. You might be surprised by how excited they are to work together. You've got this. Have a great week and follow us for more.